So evidence from social science research, we know, will help solve critical issues. We've had enough evidence to know that we can use social science to look at disparities in educational attainment as responses to global warming and other environmental harms as we continue to produce health outcomes at a lower cost. Policymakers realize that we behave as individuals and collectively in groups, and that behavior can either greatly enhance or reduce our capacity to move forward our social goals for humanity. The climate change, all of the new causes of concern that result from technology are really impacting our social programs in ways that social scientists haven't had to think about in the past. Climate change from personal behavior, migration, terror networks, human trafficking, wealth disparities, and disease. And many of the advances in science and technology have disrupted traditional decision-making hierarchies, and new challenges are hitting us in governing at the state, local, and national levels. That always comes out of my mouth really hard. So not only are we being asked to look at this broad array of policy issues, but we're asked to look at some of the solutions to what this disruptive technology and networks that Beryl Raven tells us about is impacting all of us in our thinking about public policy. What is the impact going to be at the local and the state level? So policy research, analysis, and management of public resources is a key to how we're going to address this. We need to be prepared to address the complexity of this change in order. The perspective of our government officials seems to be broadly shared within the United Kingdom and Australia that evidence-based policy can make a difference. Other social scientists and natural scientists are looking to schools of public policy and to our profession of applied public policy research and policy analysis to have a strong impact on what they're doing. I don't know if many of you have read the recent book from scientists about how science policy can be improved, but they look to us with great reverence, and they look at many of our interventions that we did in public health and in education, and they believe that the results of what we did have been impressive. We should take note of that. Healing, in his new book, Science for Science Policy, comments that in workforce policy, the evaluation of the impact of education and training programs has been transformed by a careful attention to issues such as selection bias and the development of appropriate counterfactuals, and that analysis of data about geographic differences in healthcare costs and healthcare outcomes has featured prominently in guiding health policy debates. Perhaps you should talk to Mary Jo Bain and Elwood about some of the politics that entered into that process. But I say this because it appears to people that the use of scientific evidence is easy. You just get the effectiveness measure, you just figure out the costs, and then you just insert somehow this science into the policymaking process. And I think the perspective of natural scientists that it's not a hard problem to solve by just injecting evidence into science is one that we need to take on, because they're going to be involving us in the issues that they want to solve, and as well as we need to tell them or help educate them that the issue is not as easy as they think. Another recent report from the National Research Council looks to schools of public policy to change its curriculum offerings and its research focus to make explicit account of decision theory, behavioral economics, and psychology, because they really believe that if we could just train people, I do agree with this, that if we could just give them a better perspective on how people actually make decisions, that we might be able to develop public policy in an easier and a more effective time frame and a different outlook towards what design elements we might choose. So as I say, I do think we need to pay attention to the perspective of scientists and try to educate them as to the complexity of the public policy-making environment. I think it's a very wonderful opportunity that we have with the present administration, who has a very strong perspective on how evidence-based policy analysis can be used to address priority setting and resource expenditures and social programs For the first time, I think that in a long time, we've had a major investment by the administration in evidence-based decision-making. And this has gone beyond what Peter Orszag said as the Obama administration has plans to create evidence-based social policy initiative and make it a fundamental part of the president's legislative agenda. Beginning in the 2014 federal budget, and I realize this is just a beginning, it's just an expression of interest, and I want to say that I did the first program budgeting and zero-based budgeting for President Carter. So I do know that things take a long time to evolve. But the expression of linking evidence-based outcomes to resource management and to putting those decisions back into agency management so that the resource management decisions will be linked to this information, I think, is a major step forward. And in addition to that, it's not just application of one set of methods. There's a strong recognition on the part of the administration that not every organization works in the same way or works with the same set of information. It's a learning environment that they're trying to create in the executive branch to bring a broader set of perspectives, bring people up so that they can learn to use this environment. I don't think it's a small change. I think it's an important step forward. And I don't know if Rebecca Maynard's here, but we need to give her credit for everything that she did at the Institute for Educational Sciences at the Department of Education, because they've led the way in smart use of good evidence in decision making. Not only have they made the full range of IES into a learning organization, but in the last 2 weeks, they've made the expression and the understanding that they need to look at quality improvement, that they're not going to be able to just look at the individual outcomes from individual programs and make an assessment, put out the practices, let the practices speak to themselves, but they're going to have to go to the process of educating, using the information to get it into a quality assessment and a performance management framework. Now, for those of you who've been here for a while, the acknowledgement that we're going to link program effectiveness to resource management through the people who are managing the programs and improve quality, I think is a very major step forward. It's an awful lot easier sometimes to make some pretty big changes at that level than it is in a time of scarce resources to think about some major public policy changes. So I believe that the continuous improvement component to what's happening in the federal government is a really important perspective that we need to address. It means something for us. It means, what do we think it means? It means putting the M back in APPAM. It means trying to find links between our policy analysts, our management experts, and our program evaluators. It also turns us back, as my friend Vernon Rutan would say, into experimenting and learning by doing. We just have a lot more information to do it by. Other types of evaluations are being used. I know that we have a hierarchy and a gold standard of random control trials. They work effectively to provide information that a lot of decision makers support, and I think it's an important step forward. I know that in the state of Washington and in the federal government that definitions and even some of our institutions that use the results of our research to synthesize and transmit these findings across to other people. They call them the brokers, or they call them the translators of information, the Campbell Coalition, the What Works Coalition, the Evidence-Based Coalition for Evidence-Based Policy. We need to make sure that now we're into this world where we have different assessments of effectiveness for the standards of evidence they have to do the same. We can't let this devolve into an issue where the state of Washington in law has one set of standards of evidence that allow them to, this is probably like the courts, right? Judges probably have different standards of evidence. I don't know if they're equal across the state. But we're a victim of our own success in that sense, but we have another task that we have to deal with. So the standards of what's effective have emerged over time. And I think that we do have to think about some standardization for them. And if you wonder why I'm struggling, the light's not very good with my glasses here, so just bear with me. One of the institutions that were referred to is explicitly in the OMB 2014 directive is the Washington State Institute of Public Policy. Has anybody heard of it? It's a very interesting, independent institution that reports to the state legislature. It's been around since 1983. The reason I mention that, it's being looked to by the Pew Foundation, it's being looked to by the administration as a transferable institution. They do evidence-based cost effectiveness, cost benefit analysis, comparing programs across a wide array of juvenile justice, healthcare, education programs. And they've had an amazing effect on decision making in the state of Washington. One example that comes from their 2012 Return on Investment report is that among programs that focus on juvenile justice, they had differences in yield of improvement. For the functional family therapy program, the functional family therapy program had a net benefit of $67,000 per person, per patient, per treatment. And the worst investment in a program is the Scared Straight, where people go into the classroom and policemen scare them about going to prison. Well, that program had a net loss of $5,000. Well, with that kind of disparity in outcomes, when you're using the same quality of information, you're using the same cost effectiveness approach, decision makers can't much back away from that. I've sat on the board of that organization for 8 years, and I've had the opportunity to watch the institutional design of that. And I'm not going to bother you with that at the moment, but it is an outstanding example of an institutional design. It is got a governing board of 8 people, 4 senior legislators from both chambers and both parties. The governor or her representative and representatives from 4 major universities. We sit on that board and we know every single piece of evidence that they're putting into that when they do the programs, when they think about the design. It's getting awfully big right now and it's hard to keep track of it, but it's trusted by the legislature because it has that kind of a leadership component to it and a level of independence that allows them to have a very good impact when they do come forward with their cost-benefit analysis. I see David Weimer here. They have a very good cost-benefit program, and Dick Zerbe's not here. If he is here, he will tell you that it's a standard of excellence across the board, but it is a cost-benefit program. It does value the effects of interventions and outcomes in terms of added lifetime earnings to a person's income. So that's the valuation. It's not pleasing for everybody, but it does array a set of programs so that everybody can make these trade-offs. The Pew Foundation, the reason I bring this up is the Pew Foundation has translated this program into at least a dozen states. They're going to, quote, peer review it and see if it works. But this kind of attention to evidence-based policy is happening at all of our state and local institutions.